Good morning, everyone. My name is Ian, and my presentation is about infant respiratory distress syndrome. Now, what is infant respiratory distress syndrome? This is also known as the hyaline membrane disease, or also known as the surfactant deficiency lung disease, which primarily affects premature babies. Now, what happens with NRDS? Usually, with NRDS, the baby's lungs are not fully developed and cannot provide enough oxygen, causing breathing difficulties. What is the cause? So, NRDS usually occurs when the baby's lungs have not produced enough surfactants. So surfactants are usually made out of proteins and fats, which helps keeps the lungs inflated and prevents them from collapsing. Now, with a baby, usually normally begins producing surfactants sometimes between week 24 and week 28 of pregnancy. Most babies usually produce enough to breathe normally by week 34. But if your baby is born prematurely, they may not have enough surfactant in their lungs. Demographics. So, who is most likely to develop this disease? Like what I've mentioned from the previous slide, it usually affects premature babies. Around half of all babies born between week 28 and week 32 of pregnancy, they usually develop NRDS. In recent years, the numbers of premature babies with NRDS has been reduced with the use of steroid injections, which can be given to mother during premature labor. Okay, now occasionally NRDS affect babies that are not born prematurely. For example, when the mother has diabetes, or sometimes the baby is underweight, or another reason could be the baby's lungs have not developed properly. And here is the stats. So it occurs about 1% of newborns infants, and in the United States, about 12% of babies are born prematurely, and preterm birth is usually the leading cause of newborn death worldwide. Now let's go ahead and go over anatomy. So as you can see, we have a diagram of a normal delivery up on the top corner and a premature delivery down at the bottom. So usually with a normal delivery, the newborn is born with a healthy level of surfactant in their lungs and oxygen in their blood. However, if they are born prematurely, the lack of surfactant causes the alveoli or air sacs to thicken and becomes inflamed, making it hard to breathe. This reduces the amount of oxygen-rich blood that reaches the brain and other tissues in their body. So that is the main anatomy of NRDS. Surfactant deficiency is a major cause of the neonatal respiratory distress syndrome, especially when the lungs are immature. Surfactant deficiency also reduces compliance of immature lung by increasing surface tension within the small airways and alveoli. Keeping air fluids pressure in balance is crucial to prevent the alveolus from collapsing or filling in with fluids. Now, the signs and symptoms of NRDS are often noticeable immediately after birth and get worse over the following few days. They can go ahead and include blue colored lips, fingers, and toes, which is also known as cyanosis. Rapid, shallow breathing, as you guys can see on the diagram. Um, Flaring nostrils, and a grunting sound when breathing. Now, these symptoms occurs due to the lack of oxygen perfusing to the tissues in the newborn's body. Mortality rate. So the incident rate of the infant's respiratory distress syndrome or NRDS is estimated to be about 7.8%, and the mortality rate in the premature babies are usually estimated to be about 50%. So how is NRDS diagnosed? There are usually a number of tests that can be used to diagnose and rule out other possible causes of NRDS. These may include a physical examination of the newborn infant. Sometimes a blood test may be necessary to measure the amount of oxygen in the baby's blood and also to check for any kind of infection. We also have pulse oximetry, which usually measures the amount of oxygen in the infant's blood, or a chest x-ray, in which sometimes this may show a distinctive cloudy appearance of the lungs in an infant with an NRDS. And lastly, we can also perform echocardiogram to check for any possible congenital heart disease. Now let's go ahead and go over possible treatment for NRDS. The main aim of treatment for NRDS is usually to help the baby or the infant breathe since they have difficulty breathing. Um, First type of treatment that is available is known as the CPAP, or the nasal continuous positive airway pressure. Now, this device usually provides breathing support by gently pushing air into the baby's lungs through a prongs placed in the nose. The second possible treatment that we can probably use is known as the surfactant replacement therapy. Now, this can be used if a newborn usually struggles to breathe despite the use of a CPAP. Sometimes giving an infant surfactant requires the use of a breathing tube. If so, because of the possible complications, your baby's provider will help you consider the risk and benefit of the procedure. Now, the third one is the mechanical ventilation. This usually is used only in very serious cases of NRDS. A ventilator is usually a machine that takes over the work of breathing and is a form of life support. The machine connects to a breathing tube that runs through a newborn's mouth or nose and into the windpipe. Babies that require ventilation are more likely to develop bronchopulmonary dysplasia, um, which they may also develop health problems from the breathing tube or ventilator, such as an airway or lung injury. Um, and the last treatment that I am going to be going over with is the fluid and nutrients. Now, this may be given to help prevent malnutrition and promote growth for the newborn infant. Nutrition is usually critical to the growth and development of the lungs for a newborn baby, especially if they are born prematurely. Most babies with NRDS can be successfully treated, although they have a high risk of developing further problems later in life. Some of these complications includes air leaks. Usually, air can sometimes leak out of the baby's lungs and become trapped in their chest cavity. This is known as pneumothorax. Other complications may include internal bleeding, lung scarring, or the or any type of developmental disabilities. Usually, if the baby's brain is damaged during an NRDS, due to either bleeding or lack of oxygenation, it can lead to long-term developmental disabilities such as learning difficulties, movement problems, impaired hearing, and or sometimes impaired vision. An AI model that is used in diagnosing NRDS is known as the ultrasonic lung imaging diagnosis model, based on a deep residual network. The ultrasound lung imaging diagnostic model on the DRN algorithm had good diagnostics performance in children with NRDS and can provide usually useful information for clinical NRDS diagnosis and treatment. And here are my references. Thank you so much for listening. That concludes my presentation in regards to infant respiratory distress syndrome.